Come in.
Hi, Mr. Gonzalez. How are you? Performing hand hygiene. My name's Yvette. I'm going to be your nurse today. I'm here to do a mental status assessment and a cranial nerve assessment. Is that okay?
Yes.
We're going to go ahead and get started, and I'm going to ask you a few questions. Have you ever been diagnosed with anxiety or depression?
No.
And do you have a history of any other mental disorder?
No.
Okay, perfect. So I'm going to go ahead and get started with the mental status assessment, and I'm just going to go ahead and say it out loud. So I can see that the patient's appearance is appropriate for being in his own room, and I can also say that his speech is clear, that he's alert, and he's aware of the situation that we are in. Now I'm going to go ahead and ask about your orientation. Could you tell me what year it is?
2020.
Can you tell me the president?
Donald Trump.
Can you tell me your name?
Julio Gonzalez.
My name?
Yvette Delgado.
And can you tell me where you are?
In my room.
And can you tell me what we're doing?
An assessment.
Okay, perfect. So then memory is intact and he's oriented ×4. Now we're going to go ahead and screen for anxiety, depression, and suicide. You have 3 answers that you could say. The first one would be never, some days, or every day. I'm going to ask you a few questions about anxiety. In the past few weeks, have you felt so anxious that you couldn't function?
Never.
In the past few weeks, have you felt that you've been worrying so much to the point where you can't stop worrying?
Never.
Okay, now for depression. In the past few weeks, have you felt blue or down to a point where you couldn't function normally on your everyday routine?
No.
Okay, in the past few weeks, have you been down to the point where you just don't want to continue with your day or anything?
Never.
Okay, perfect. And now for the screening of suicide. In the past few weeks, have you been in a day or anything like that that made you feel like you didn't want to live?
No. Never.
And then in the past few weeks, have you felt so down that you thought of harming yourself?
Never.
Okay, perfect. So now we're going to go ahead and move on to the cranial nerve portion of the assessment. We're going to start off with cranial nerve number 2. And in order to test for that, we would do the Snellen test for visual acuity. And then now we're going to go ahead and do a confrontation test. And by that, you're going to hold one of these cards in front of your eye like me. And then I'm going to move my finger in front of you, and you're going to tell me when you can see it, okay?
No. 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 No.
Perfect. And now I'll switch to the other eye for me. And then again.
No. No. No.
Okay. One last one.
No.
Okay, perfect. So then that's how you test for cranial nerve number 2. I can go ahead and take that. And then now we're going to test cranial nerves 3, 4, and 6. And we do that by doing the pupillary reflex, the 6 cardinal directions of gaze, as well as testing for accommodation. So you could just look straight at me, Mr. Gonzalez. Good. Other side here. Perfect. Both pupils should constrict upon the pupillary light reflex. And then now, if you could go ahead and look at the top of my pen here. And then you're going to follow it with both eyes, okay, without moving your head. And then last but not least, still follow the pen. Perfect. So both eyes should move together for the 6 cardinal directions at the same time. And for the test of accommodation, both eyes should move together as well as looking in. Now we're going to go ahead and test for cranial nerve number 5. I'm going to go ahead and ask you to clench your teeth really hard like this for me. And I'm going to go ahead and palpate here, feel. You should be able to feel the muscle feeling tense here. And then if you could close your eyes for me. The other part of cranial nerve number 5 is a sensory reflex. So I'm going to go ahead and touch your different parts of your face, Mr. Gonzalez, and you say now whenever you feel it.
No. 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 No.
Perfect. Now we're going to go ahead and move on to cranial nerve number 7. I'm going to ask you to smile for me. Good. Now can you frown? And then can you close your eyes for me? Good. And then go ahead and lift your eyebrows up for me. Perfect. Now we're going to go ahead and test cranial nerve number 8, and that is the whisper test. I'm going to whisper something on either side, and then you're going to go ahead and repeat what I said.
Red ticket.
Black shirt.
Black shirt.
Okay, perfect. And now we're going to go ahead and test for cranial nerve 9 and 10. If you could go ahead and open your mouth for me and then say ah. Thank you so much. So in order to test for cranial nerves number 9 and 10, you would see that the uvula rises when the patient says ah. Now we're going to go ahead and test for cranial nerve number 11. And then if you could look straight at me, and then I'm going to put my hand up against your cheek here, and if you could push against it on either side. Perfect. And now the other side. And then I'm going to put my hands on your shoulders here, and if you could shrug and push them up for me. Perfect. And then last but not least, cranial nerve number 12. If you could look at me straight and then go ahead and stick your tongue out for me. And then that would be showing that the tongue is midline. You could go ahead. Thank you so much. And that is the end of the mental status.